How do you safely have hair salons and nail salons and tattoo parlors where people this is in Georgia, where people have to inherently be close together?
I think what I've been trying to communicate over the last several days is it's really important that the governors and mayors communicate critical information to their communities and show very clearly the data. Remember, we wanted this data and evidence-based, the data that they utilize to make decisions and the data that the mayors should use in each of the communities, because it will have to be on a community-by-community opening, because there are different communities in different places, even in Georgia. And so I believe people in Atlanta would understand that if their cases are not going down, that they need to continue to do everything that we said: social distancing, washing your hands, wearing a mask in public. So if there's a way that people can social distance and do those things, then they can do those things. I don't know how, but people are very creative. So I'm not going to prejudge, but we have told people very clearly, and the President guidelines made it very clear about the expectations of phase one. And remember, phase one also included social distancing in restaurants, social distancing in every place that was entertainment, and keeping your own individual social groups to less than 10. I mean, we've been very clear in the guidelines, and I think it's up to the governors and mayors to ensure that they're following the best they can each of those phases to make sure that both the public is completely protected. But the governors and mayors also need to communicate very clearly on the data that was used for decision making and make that transparent and available to their communities.
Sanjay, we heard something very, very intriguing from Dr. Deborah Birx, who's the coronavirus response coordinator, on what's going on where you are in Georgia right now. The governor saying that this coming Friday, they're going to open up tattoo parlors, hair salons, nail salons, massage parlors. And she said she doesn't know how they can do that and at the same time maintain the guidelines of social distancing, which requires people to be at least, 6 feet apart. This sounds like that Dr. Birx is totally disagreeing with the governor of Georgia.
She was disagreeing as politely as she could, I think. She said, look, she said this, I wrote this down. She said, we have put out the guidelines. We've made this as clear to use as possible, the data. We're still seeing outbreaks. I don't know how people could actually do these things and maintain social distance. It is the governor's choice. Maybe they'll get creative. President Trump was then asked about the same thing regarding Georgia, and he said he's going to be talking to Governor Kemp later on and said, I don't know either. Maybe they're going to be doing testing at all these places. I think he was referring to nail salons and hair salons and things like that before people actually utilize these services. We know that's not happening. People aren't getting tested before they would go into these places of business. So it was very interesting to hear how they sort of talked about this, still saying it is up to the governors. They can decide. But we provided the guidelines. We provided the data. If they're going to do this sort of thing, open up these businesses, they're going to have to explain their rationale for doing so, because it doesn't coincide with any of the guidelines we put out. Guidelines were designed to try and create a situation where it was safest to try and open up some of these businesses, knowing full well that no matter when this happens, Wolf, when these businesses start to open, there will likely be some rate of increase of infection. But right now, it's so early, the numbers have not been going down, and there's not the infrastructure in place. So it was a very polite, yet I think very clear sort of remark about Ambassador Birx's thoughts on reopening things here in Georgia.
And on the other headline, Dr. Sanjay Gupta, as far as Dr. Birx being very polite to her colleague, the head of the CDC, Robert Redfield, suggesting in this Washington Post interview that a second wave of the coronavirus coming in the fall or winter could be even more deadly than what we're all going through right now. And at one point she said, I don't know how that could be more deadly than what was going on in New York, for example. She was also polite, but she seemed to disagree with his assessment.
Yeah, she did. I caught that as well, Wolf. And I think that was more sort of an effort by her to just say, look, we're still in the throes of this right now. We're still in the middle of this first wave, so let's not be diminishing that or minimizing that in any way. But, Dr. Redfield has sort of alluded to this in the past, and so has Dr. Fauci. This idea that, if you look at how things sort of played out this time, the coronavirus outbreak in the United States sort of came as flu season was starting to trail off a bit, and that may have been helpful. The concern is that if they both sort of start to arrive at the same time in the fall, they start to peak at the same time, that could be very significant for hospitals in terms of how they would care for these patients. We keep talking about ventilators, for example, Wolf, and saying, hey, maybe we didn't need the ventilators, and maybe we didn't need them as much for this first wave. But the concern is that the second wave, when you're getting so many patients from both flu and coronavirus at the same time, you likely would need a lot of these resources again. Ventilators, personal protective equipment, testing, tracing, all the things that we've been talking about for some time. Those requirements are not going to go away until we have something like a vaccine, probably. So again, we've heard this a few times in different ways. Today was perhaps the most stark representation of that, the way Dr. Redfield put it. But I think this information has been out there. Maybe we have to social distance a lot longer than we realized, at least intermittently. You remember that Harvard study, Wolf, that said maybe we'd have to do this until the year 2022. I don't think it's going to be that long by any means, but you're starting to hear the same sort of message from, I think, lots of different places, Wolf.
It's interesting. Gloria Borgers with